Today, we're going to talk about a threat that's been with us for, well, forever. It's a hidden enemy that lurks in the most ordinary places you can imagine. We're talking about tetanus. And trust me, the story behind it is way more like a thriller than some boring medical lecture.
So let me just ask you this. What do you think lives right under our feet, in common soil, and can produce a toxin so unbelievably powerful it can literally lock your muscles solid, all while you're completely aware of what's happening? The answer is pretty wild, and it's the key to understanding this whole thing.
All right, first up, let's meet our villain. We're dealing with a bacterium that's basically a silent, microscopic sleeper agent, just waiting for the perfect moment to strike.
Clostridium tetani. But what's really important to get here is that the bacteria itself isn't the main problem. No, it's the incredibly potent neurotoxin it produces that turns what could be a simple infection into a massive medical emergency.
And this thing is everywhere. I mean, its spores are in the dirt in your garden, they're in the dust in your house, in animal waste. You name it. And they are tough. We're talking capable of surviving for years, just waiting for a chance to get inside a host.
So, how does it get activated? Well, it all starts with something as simple as a break in the skin. A little cut or scrape you might not even think twice about. The spores get in, and that low oxygen environment inside a wound, that's the perfect trigger. They wake up, they start to multiply, and then they begin pumping out that dangerous toxin.
Okay, so once that toxin is released, it starts its terrifying assault on the body. And this leads to the one symptom that tetanus is famous for, lockjaw. But the attack isn't immediate, and that's what's so tricky. Symptoms usually show up about 5 to 10 days after you get hurt. Because of that delay, people often totally forget about the little cut that started it all, which can make the diagnosis a huge shock.
The way this toxin works is just nasty. It doesn't stay put in the wound. It travels through your body and hijacks your nervous system. It basically blocks the signals that tell your muscles to relax. So what's the result? Your muscles are stuck in on mode, uncontrolled, constant contraction.
And to give you an idea of just how bizarre and awful this is, listen to this description from medical texts. The muscles in the face spasm into this fixed, rigid smile. It's a chilling mask they call rhesus sardonicus, or the sardonic grin.
It usually starts with that classic lockjaw, but it gets worse and fast. The spasms become so powerful they can literally arch a person's back and neck. And maybe the most terrifying part of all, the patient is usually completely conscious and aware through the entire ordeal.
So this brings us to the hospital, where treating tetanus is an urgent, incredibly complex battle fought in the ICU. This isn't just about taking a pill. It's a full-on war against the toxin's effects.
Doctors have to attack this on multiple fronts, all at the same time. They've got to clean the wound to get rid of the source, give an antitoxin to neutralize any poison that's floating around, and use antibiotics to kill the bacteria factory, all while providing life support and trying to manage those agonizing spasms.
And it's really important to understand this two-pronged attack. Think of it like this. The antibiotics are there to shut down the factory that's making the poison. The antitoxin, that's like a special forces team sent in to find and neutralize the poison that's already been released. You absolutely have to have both.
But after hearing about all that intensity, here's the best news. The solution is actually remarkably simple. So let's talk about our ultimate shield against this enemy, prevention.
Now get this. This is an incredible fact. Surviving a tetanus infection does not make you immune. You can get it all over again. The only reliable way to get immunity is through vaccination. The vaccine basically teaches your body how to fight off the toxin without you ever having to get sick in the first place.
And that's exactly why we start building this shield from a very, very young age. The DTaP vaccine, which covers diphtheria, tetanus, and pertussis, also known as whooping cough, is given in a series of 5 shots during early childhood. This builds a really strong foundation of immunity.
But that shield doesn't last forever. Immunity starts to fade over time, and that's why adults need a booster shot every 10 years, just to keep those defenses topped up and strong.
So let's wrap this all up with some clear, practical advice, because honestly, knowing what to do is how you stay in control and keep this hidden enemy from ever becoming a problem.
So, if you get a cut, do you need a shot? Well, it depends on 2 things: how long it's been since your last booster and how dirty or deep the wound is. As a good rule of thumb, if it's been over 5 years and you've got a deep or dirty wound, yeah, a booster is recommended.
And if it's been more than 10 years since your last one, you need a shot no matter what kind of wound it is.
And that really brings us to the final and most important question. Tetanus is a genuinely terrifying disease, but it's also almost entirely preventable. The power to protect yourself is actually pretty simple. So let me ask you, is your shield up to date?